Pneumonia. Let's talk about it. Remember, we don't think of pneumonia as just a cough. Now, that's too simple. Pneumonia is deeper. Remember, pneumonia is when an infection reaches our lungs and it attacks something called alveoli. Now, those are the tiny air sacs where oxygen moves into our blood. Now, once those sacs are filled with fluid, pus, or inflammatory cells, oxygen can no longer reach our bloodstream properly. That is the real danger we're talking about. Now, pneumonia can be caused by bacteria, viruses, and sometimes fungi. The most common bacterial cause is Streptococcus pneumoniae. Now, viruses like influenza also trigger pneumonia, especially in vulnerable patients. Let's talk about that. Now, here is what happens inside our body. The organism reaches the lower lungs and the immune system reacts. With that being said, white blood cells rush in. Now, blood vessels become leaky. Fluid collects inside the alveoli. Instead of the air, those sacs are filled with inflammatory fluid. And when that happens, oxygen diffusion drops down. The body senses low oxygen and tries to compensate by breathing faster. So when you see a patient breathing rapidly, understand it is compensation. This patient is not in a panic mode. So in pneumonia, you see that these patients have fever, they have productive cough, shortness of breath, chest pains that worsens when they are breathing, crackles when you are auscultating, and weakness or fatigue. Now, in elderly patients, sometimes fever is absent. Instead, these patients end up being confused. That's what happens at first because the brain is sensitive to low oxygen levels. Now, pneumonia is classified into community acquired pneumonia, that is the CAP. Or we also have the hospital acquired pneumonia, that is the HAP. Also, we also have the aspiration pneumonia. Now, classification matters because each type has different organisms and treatment strategies. Diagnosis combines clinical assessment. Chest x-ray will show consolidation, oxygen saturation, and sometimes lab tests. Now, treatment depends on the cause and the severity of the pneumonia. Now, let's talk about it. The bacterial pneumonia, you treat it with antibiotics. The viral pneumonia, you treat it with supportive care and antivirals. Now, the moderate to severe pneumonia, you treat it with some supplemental oxygen. Severe or unstable patients with pneumonia, you hospitalize them. Sometimes you send them to the ICU. It is very important. Now, complications are what makes pneumonia dangerous. We have the pleural effusion, the lung abscess, sepsis, acute respiratory distress syndrome. That's the ARDS. Now remember, ARDS is when oxygen exchange across both lungs fail. Now this can be very much life-threatening. I want you to watch out for these signs. That is the worsening shortness of breath, persistent high fever, low oxygen saturation, increase in fatigue. Now, these are not normal. They require urgent medical attention. Now, remember, prevention is powerful. We need to vaccinate against pneumococcus and influenza, smoking cessation, hand hygiene, early treatment of respiratory infections. Pneumonia, remember, is common, but common doesn't mean harmless. Now, in children, in the elderly, the diabetics, the immunocompromised patients, it can escalate very quickly. Your job, my job as a healthcare professional is to recognize it early, intervene quickly, and educate patients before these complications develop worse. Now, pneumonia is more than an infection. It is a disruption of oxygen. And remember, without oxygen, we both cannot survive. I always come here to teach you. I'm going to see you soon. My name is Nurse Solomon.